Today I'm going to share with you some information about the relationship between music and pain and how music therapy might be able to help with pain management. First, we'll talk about what pain is in a physiological, neurological sense. Then we'll go into the research behind music and pain and music therapy and pain and what's happening in the brain. Then I'll share with you some music therapy interventions for pain management, so stay tuned. Hey guys, I'm Leela from Uku-Lela Therapy. I'm a board-certified music therapist and licensed mental health counselor, and I use music in fun, creative, and research-based ways to help with things like mental health issues, wellness, and self-development. First of all, what is pain? Obviously, we all know what pain is and what it feels like, but what's happening in the brain? Pain is a signal to our brain that something is wrong. When our pain receptors are triggered by something painful, like putting your hand on a hot stove, it sends electrical signals to the brain, and in the brain, these signals are processed in a variety of regions, including regions associated with emotions, memory, and decision-making. Sometimes we don't know what is wrong, like in the case of chronic pain or chronic illness, and this can be especially frustrating because obviously we want to get rid of the pain, and the pain is there to give us a signal, but if we don't know what it's trying to tell us or what to do with it, kind of hard to eliminate, which is why in a lot of cases of chronic pain and chronic illness, the goal it is to eliminate the pain if possible, but a lot of the times there's a major overarching goal of just managing the pain, and this is where music therapy can come in. Let's go into some fun research about music and pain, shall we? This article states that pain can have a negative effect on emotions and on cognitive function. Conversely, a negative emotional state can lead to increased pain, whereas a positive state can reduce pain. Similarly, cognitive states such as attention and memory can either increase or decrease pain. So basically, our perceived intensity of pain can change based on our emotional state and vice versa. So if we're feeling more anxious and depressed, then we might perceive pain as stronger, and if we're feeling happier, more relaxed, we might perceive our pain as less. And you can see how this might become a negative cycle. If we're feeling anxious and depressed, we feel more pain, and if we feel more pain, we become more anxious and depressed. That's not fun. This article states that there was a significant decline in the functional pain score in the music therapy group, but not in the control group. The mean decline was significantly greater in the music therapy group than in the control group. This article states that pain scores were reduced significantly after completion of music therapy. Findings supported the benefits of music therapy for patients with neuropathic pain. And in this meta-analysis, which is basically just a collection of a bunch of studies on similar topics, states that in the 97 included studies, it was revealed that music interventions had statistically significant effects in decreasing pain. Now we know that music has been shown in the research to decrease pain. So let's talk about what happens in the brain and some ways to use music to help with pain. When we're listening to music or engaging in music activities, there may be endorphins, dopamine, serotonin, and oxytocin released in the brain. These effects can help distract from pain, it can help modulate our pain perception, and can create more favorable psychological states for pain management. This article states that listening to music you like releases opioids in the brain that soon spread throughout your body. This natural pain reliever reduces the feeling of pain while you enjoy the music. Not only does this technique help fight pain, it also reduces depression and anxiety, which can also be contributing factors to increased pain. So we know that opioids are like a pain reliever drug. So I think that's just really cool that our brain just releases natural opioids in response to music. Let's get into the music therapy interventions that you can use for pain management. So based on what we've learned so far about music and pain management, some goals in using music therapy for pain management might include improving your emotional state, since we know that the better we feel, the less pain we might feel, identify and reframe thoughts around pain, find ways to manage pain, and process emotions surrounding pain. And here are some more specific interventions that might address these goals. One is music listening, and it's important that this is your preferred music that you like, and even just 20 minutes a day of intentionally and mindfully listening to preferred music is an enjoyable and simple intervention. It puts your focus on something enjoyable, it can uplift your mood, and it can be a good distraction. Another intervention could be examining and reframing thoughts around pain. So we have the initial pain, and then a lot of times we have thoughts about that pain that might make things feel worse. Pain is bad enough. We don't need to throw logs on the fire here. Some of these logs we might throw on the fire might be things like, there's nothing I can do about this, or I'm gonna feel like this forever. I won't be able to do anything I love ever again. And while there might be some truth to some of these statements, they're also very extreme and don't really help the situation. So by using something like songwriting, you can kind of explore what these thoughts might be for you and how to reframe some of these thoughts. Like, there are some things I can do. It might be different than what I used to be able to do. I just need to find new ways of doing things. Or I have some good days and some bad days. Another great intervention for pain management is active music making. And one of the first things I think of that's really simple is just singing along to music, especially during chores or activities that might be a challenge for you. Like if you dread doing the dishes because you know it's gonna take a lot of energy and it's gonna cause a lot of discomfort, when we're singing or listening to music, it sends messages to our brain that we're good and we're safe, because we're often not singing when a bear is chasing us. So if you're feeling safe and relaxed, it can decrease your pain levels. Another intervention could be movement and stretching to music. And this requires you to know and understand your body and your limits, so I encourage you to work with a professional who can help you with these stretches or figuring out what movements work for you. But sometimes in the case of pain, moving and stretching is the best thing for your body. Another intervention could be addressing and processing emotions surrounding your pain. This could be done through lyric analysis, songwriting, music listening, maybe just choosing some songs that you relate to in your experiences. Because people who struggle with pain, and especially chronic pain, not only struggle with the physiological part, but there's a huge mental aspect to that as well. You know, there's a lot of emotional challenges. There's loneliness, there's isolation, depression, anxiety. So it's really important to address these things as well. I know I mostly focus on chronic pain here in this video, but there are a lot of ways to use music in pain. Sometimes it's used in hospitals during surgery or during procedures. It can be used during things like chemo, or in the case of children, you know, hospitals can be a scary place for children or doctor's offices. So just using music and singing in those cases could be really helpful. And of course, music isn't a cure for pain. It's called pain management for a reason. And a lot of times people are struggling to find a cure or a reason for their pain. So if your goal with chronic pain is to cure the pain forever and to find a solution, I think that's a great overarching goal, but it can also lead to a lot of consistent frustration and disappointment. So in addition to this goal, some other helpful goals to have might be to find ways to manage or lessen the pain, to be able to find ways to live your life as close to the way you want as possible within your means, and to find ways to not make it feel like pain is controlling every aspect of your life. And I really think incorporating music or expressive arts and things like that can really be helpful in accomplishing some of these goals. Well, I appreciate you watching this video. I hope it was helpful for you in some way. If it was, please like, share, and subscribe. I post videos every Friday about mental health, music, expressive arts, all that fun stuff. So subscribe to see more content like this. Thanks for watching, and I hope you have a great day. Bye.